like from where you can see where it says consultation?
Okay, I'm gonna put it in for 12 tomorrow. Is that okay?
Hey, are you the pharmacist?
Yes, my name is Megan. It's nice to meet you.
Nice to meet you.
How
I'm
can I
here.
help you?
I just have a lot of acne, and I've tried a lot of products, and nothing's working for me right now. And I was just wondering if you could help me out.
Okay, well, can you tell me kind of what's been going on?
Well, I just have a lot of whiteheads, a few blackheads here and there. As you can see, it's all over my face. I'm just trying to get it cleared up because it's embarrassing, and I just don't want acne anymore.
Okay, well, let's see if we can go down the aisle and find you something. You can tell me about some of these products you've been using.
All right, sounds good.
I don't have the person.
Okay, so why don't you go ahead and tell me about some of the products you've been trying, or some of the remedies that you've been trying for your acne.
Well, the first thing I tried was lemon juice, and that just didn't work at all. Lemons! Oh, it burns! Another one I tried was tomato products. I've heard that helps, but that didn't work at all either. Okay. Mine's 57. Another one was tinfoil. Clearly didn't work either. I got a bad feeling about this one. Ah! And another one that I've tried is extreme hydration. And that didn't work.
That's interesting. All right.
Extreme hydration. And the last one that I tried was toothpaste.
Toothpaste, okay, and that didn't work for you at all?
That one
Okay.
didn't work. Toothpaste.
Well, let's see if we can get on this aisle and find you some different products with some active ingredients that can help clear some of that up for you. Okay, so I do see that you are experiencing some acne, but however, there's not a lot of inflammation or anything involved, so you do have grade 1 acne. So we can treat this with over-the-counter medications. Why don't you go ahead and tell me what you're doing throughout the day? Like, what are your cleansing habits?
Well, I do like to go to the gym every day, and sometimes I take a shower, sometimes I don't. I mean, it just depends on my day. Sometimes I'm too busy and I just don't take a shower.
Okay, well, if you can, you need to try to wash your face up pretty thoroughly at least twice a day. And you need to try not to, like rest your chin in your hand or anything, because that can produce, some more oil on your skin.
Before Megan tells Eric about the treatments there in her pharmacy, it is important to note some non-pharmacological treatment options. These include cleaning the skin with a mild soap, staying hydrated, and avoiding high glycemic foods such as white bread. There are also pore strips that help in removing blackheads without pinching or squeezing the acne, both of which are not recommended.
Okay, so as you can see, there are a lot of different products you can use to treat acne. One thing I'm going to tell you can maybe start with is just a daily cleanser. It doesn't have any active ingredients or anything in it. It's just kind of like a mild soap. And like I was telling you before, to wash your face twice daily very thoroughly, you're going to use this product, just lather it up on the skin, and then rinse and pat dry twice a day. And I know that you were mentioning going to the gym. Do you ever get really oily when you go to the gym?
Yeah, every time.
Okay, if you do, you can try and use some of these oil absorbing pads and just try and, pat the areas that, you do have more excess oil production in, like, around the nose or your chin or your forehead maybe. And you can use these throughout the day instead of having to rewash your face every time.
Okay.
You could also try the benzoyl peroxide gel. What you're going to do with this at night, whenever you're done washing your face, you're going to apply a thin layer of this right before bedtime.
Okay.
One other option would be a salicylic acid containing product, like an astringent. Same thing, after you're done washing your face, you're going to moisten a cotton ball and just kind of rub it on there a little bit. And this can make your skin dry out a lot. So what you want to do is you want to use it once daily to start out with. And then if you don't see any irritation or dryness occurring, you can move up to 2 or 3 times a day, maybe even after you work out, to get some of that excess oil off your skin.
Okay.
Okay, so can you kind of go back through some of these products with me?
Yeah, so you first recommended that I get a cleanser, and I use the cleanser pretty much twice a day to clean the oil off my face and everything. And then after that, since I go to the gym a lot, I could use an oil absorbing sheet, like during the day, just to get the oil off from after the gym. And the first product, the medicated product that you recommended, was benzoyl peroxide, and I can use that at night after I wash my face?
Yes.
Okay. And I just wash my face, pat it dry, put a thin layer on? Is that
thin
correct?
layer, yep.
Okay. And then the other product you suggested was the salicylic acid astringent.
Yes.
And start out using it once a day, right?
Right, once a day.
Because
and then
it can
you
dry my face out.
That's
Okay.
exactly right. And with all these products, you want to just make sure that you don't go in the sun a lot. You don't want a lot of excess sun exposure. And these products should show some improvement in your skin within 4 to 6 weeks is the typical time period.
Now let's just summarize and add to the points Megan discussed with Eric. Some common OTCs used in the treatment of acne include benzoyl peroxide, a product that increases skin turnover and acts as an antimicrobial, treating inflammatory and non-inflammatory lesions. There is salicylic acid that produces anti-inflammatory effects. Sulfur is another product that inhibits some bacterial growth, and resorcinol that is both an antibacterial and antifungal. Many cases of acne are self-limiting, but it is important to tell our patients that acne can persist for long periods of time and can require long-term, continuous, and consistent treatment. Some exclusions for self-treatment include severe inflammatory acne, drug-induced acne, mechanical irritation-induced acne, and rosacea, which requires a diagnosis.
Okay, so did you have any more questions for me?
No more questions. Thanks for your help.